The practice for the Plastic Surgeons of Lexington is the original practice in all of Central Kentucky. It goes back to 1952 when Andy Moore Sr. came back from World War II and settled here in Lexington, Kentucky and started the practice.
There's essentially no service that we do not provide. We have everything from skin care to hair transplant to cosmetic surgery on all areas of the body. So we are a full-service plastic surgery outfit.
I don't want to just sell a patient products. We're here to provide results. We're a results-oriented practice.
So as a patient coming into our office, you're warmly received when you walk in the door, and we will go out of our way to schedule your case at the most convenient time for you.
Liked what he had to say and felt a lot of confidence in him, and I've been happy ever since.
If you have questions, they are more than willing to take the time to answer anything that you have questions or concerns about.
I felt like I was at home. Dr. Hill answered all my questions. He listens carefully. I wanted to make sure I got the best, and that's why I chose him.
I love the process. I'm really grateful to be part of the process. This is a wonderful place to work. We're really like a family, and we hope that our patients feel that way when they're here.
It takes years of training, compassion, and talent to be a winning plastic surgeon. From Botox to mommy makeovers, Plastic Surgeons of Lexington, helping patients achieve natural results for more than 70 years. Emerge confident.
Hi, Plastic Surgeons of Lexington patients. Thank you for watching. I'm Katie Herndon with Reach Fitness, and we're going to discuss some general fitness recommendations 2 weeks after a breast augmentation. As always, if you have any pain or anything feels uncomfortable as you're working out, stop and contact your surgeon. Every patient is different, so every patient is going to progress differently. So do what feels good to your body. At 2 weeks post-surgery, you're good to start some gentle cardio, walking, cycling, but we want to avoid pushing, pulling, upper body work, no running yet, and no holding yourself up. No holding weights and no reaching overhead. I'm going to go over some exercises that you could do 2 weeks post breast augmentation. Start with 2 to 3 sets of 10 to 15 reps as it feels good in your body. So something you could start with are body weight squats, keeping your core engaged, feet a little bit wider than your hips, push your hips back and sink down just as you are going to sit in a chair. You can even do these to a chair if that helps as well. Some body weight lunges, so standing tall, step back, one side and then the other. Once again, we don't want to weight these yet. We don't want to be holding dumbbells or anything. Step ups are a great thing to do at home. So find a low stair and step straight up and come back down. You can also use bands if you have them for a banded abduction. These can be done seated or standing. Band goes above your knees, push your hips back, take the knees out and in, or seated. While you're not ready to start upper body work 2 weeks post breast augmentation, it is a good idea to start with a little bit of shoulder mobility to keep everything nice and open. So something I recommend for this is shoulder cars, which just means moving your shoulder blades in a circle. So you would start with your arms out, squeeze your shoulder blades together, down, reach forward, and then up. So your shoulders come back, down, forward, and then up, making a circle. And then you can reverse that circle. If holding your arms up isn't for you yet, you can also do these with your arms by your side. Shoulders up, down, and around.
It takes years of training, compassion, and talent to be a winning plastic surgeon. The safe and innovative body sculpting procedures offered at Plastic Surgeons of Lexington are designed to define and sculpt the shape of your body. Whether you want to eliminate sagging skin, remove excess fat, or improve your overall shape, Plastic Surgeons of Lexington will help you gain confidence and live beautifully, helping patients achieve natural results for more than 70 years. Plastic Surgeons of Lexington. Emerge confident.
Hey, welcome back. Well, if you're losing your hair, you can gain it back with state-of-the-art NeoGraft. The Plastic Surgeons of Lexington is offering the service. They are the original plastic surgery practice in Lexington and Eastern Kentucky, dating back to 1951. Dr. Michael Lynch and Dr. Joseph Hill join us with more. Welcome, guys. Good to see both of you. Thanks for coming in.
Thanks for having us.
NeoGraft. What is that? How's that work?
Well, it's state-of-the-art technology that just kind of came out a few years ago, and it's different than the standard hair transplant technique where they used to harvest a strip of your scalp from the back and left with a big incision that you had for the rest of your life.
Sounds painful too.
It is painful.
Yeah.
And this was more, this system has a machine that allows you to take small little punch biopsies and take the entire hair follicle and then transplant it, and it's your native hair where it belongs,
right,
where you've lost it.
And I guess it's important to have blood supply, and it gets all of that, and so we get good growth, good results so far with that, guys?
Results.
Scalp is very vascular, so it tends to work well.
Anybody who's bumped their head at night knows, because it looks like a murder scene right away. Where's all this blood coming from?
Exactly.
But the typical clientele, who are we talking about usually? Who are we helping with this?
Men typically over the age of 30 who have any kind of hair loss. You can also take care of women with hair loss. Sometimes people have loss of their eyebrows. We can also use it for that as well.
And how invasive is it? It's not as invasive as we've seen before, but
no, it's not. I mean, it's going to be done in our office. It's just under some numbing medicine. It takes about 5 hours or so to do an entire scalp hair transplant, but it's not as invasive as the old strip technique that like Bosley and other institutes talk about. This is a much more less invasive procedure, and you get even better results.
Why has it been such a conundrum? I mean, with all the wonderful things that we've had with medical science over the past 200 years, why has this one always sort of been the thing that's the enigma?
Well, there's not a magic bullet to it. You know, they haven't been able to come up with a magic bullet to solve hair loss or male pattern baldness in particular. There are some medicines on the market, but those tend to not really, they tend to just keep what you have. What we're trying to do is replace what's missing.
And this is, could it possibly be helpful for injuries or some other happenstance that comes across that you guys see?
Absolutely.
Absolutely.
Yeah.
You know, sometimes we'll have a skin cancer that develops in the eyebrow, for instance, and it's a good way to, you know, to reconstruct the eyebrow. Absolutely.
My name's Stephanie Nance, and I'm a little nervous, but my anesthesia lady back here is going to make me feel much better. So I'm waiting on that, but they've got me all marked, and I guess next is the OR, so.
What made you want to get this?
I had kids really young, body changes a lot, wanted to go back to normal, so I can continue to get more healthy and continue to see results for my workouts.
All right, we're here with our patient today in the preoperative area, and we've done our markings. So we're planning a bilateral subfascial augmentation. We've marked kind of the parameters of where our implant width is from here to here, and then how high it's going to go. We're planning subfascial because of the level of breastosis. Here's our abdominoplasty marks. Underneath, we measured 6.5 centimeters from the vaginal cleft, and this is the amount of tissue we expect to get out.
A new survey finds that women across the generations experience a disconnect between how young they feel and how old they look. More than 80% of women in the survey say their faces show signs of aging. Changes in the underlying structure of the face are the main culprits in facial aging. These are the changes that cause women to look into the mirror and see an image they no longer consider youthful. You can see the effects of aging in this 50-something mother and her 20-something daughter during routine facial assessments by specialists. Notice how different areas of the face change with age because of bone loss, fat redistribution, and loss of collagen. The younger face appears almost as a single structure, with smooth facial contours and very little shadowing between the various areas of the face. With aging, changes in both surface and subsurface structures of the face cause separation of these areas. In normal ambient light, age brings undesirable shadows that appear at various locations on the face. The goal of aesthetic correction is to help individuals be the best version of themselves with a youthful, natural-looking result over time. Conversations about aging need to be more than skin deep. Talk with your trusted specialist about having a facial assessment to develop your plan for natural-looking results and a more youthful appearance. And join Aspire Galderma Rewards today to earn exclusive rewards, bonuses, and discounts so you can feel good about looking your best.
Hi, my name is Marguerite. I was a little bit more self-conscious about big smiles because it really accentuated the lines on my face, especially when I saw them in pictures.
Hi, my name's Kristen, and when I see myself in the mirror, I'm a little surprised that I'm as old as I am because that doesn't match the picture I have of myself in my mind.
Hi, my name is Alfie. Every now and then you stop and look and go, wow, I didn't have those lines before. And you start to notice them on yourselves and on your friends, and you realize, okay, age does take its toll.
Two flexible gel fillers that help maintain natural expression in motion.
I've always been a happy person, a happy individual with a very positive outlook, and I smile all the time. So I've noticed as I age that I did get stronger laugh lines on the side.
When we were taking family photos in the past, I found myself staying behind the lens. I stopped liking how I looked in photos. I started to focus on the areas that I wasn't happy with, and it got in the way of me getting into those memories.
So my husband and I are so grateful that we had the opportunity to adopt two really great kids, two boys. But you know, there was a significant amount of stress involved. We noticed that we both felt a little bit more tired, and particularly for me, I felt that the lines on my face had gotten quite significantly deeper over the last 10 years.
Any concern I would have about getting filler would mainly be that I look like myself when it's done, that it's just a better version of me. All of the responses to my results have been positive. My husband was really happy to see that my appearance wasn't changed.
My concerns and fears about getting a filler, I just want to make sure that people don't go, oh my gosh, did you get a facelift? As soon as they see me, that I look natural. It's beautiful. I'm so surprised and happy with the results. Most people don't really notice exactly what's changed. They just notice that something has changed, and I love that.
I just want to make sure that it's done so it looks natural and it looks like I'm actually relaxed or just come back from vacation. I have to say, since I've been treated, I've had a few people comment on my appearance. You look like you've had a good night's sleep, or were you away, or what did you do on the weekend?
I was able to return to work almost right away. I certainly love the way it looks, and so I would want to just maintain this. So I would definitely continue.
I would say the specific differences that I've noticed since having this procedure is that I can smile freely. I don't have the laugh lines that I used to have before.
It made a huge improvement in my looks and an even bigger improvement in how I felt about my looks.
Having a beautiful smile just makes you feel good and you want to go out and conquer the world.
I love to laugh, and I really feel that this is reflective now on the outside who I am on the inside.
Now I will be in the photo with my family making those memories.
The plastic surgeons of Lexington, Dr. Joseph Hill and Dr. Mike Lynch. Now, I teased it with hair transplants, but baldness is a big issue both for men and women.
It can be more devastating for women, in all honesty. And we see kind of a mixture, 50-50, between men and women that come into us to seeking out hair rejuvenation.
Now, you use hair rejuvenation. There's more than just one way to do that.
That is correct. So there's a couple treatment modalities. The big one is hair transplant, and we have a new machine that we are offering the community. An alternative, maybe sort of an introductory level treatment, is something called platelet-rich plasma, and you inject it into the scalp, you harvest it from someone's vein, and it's been shown to improve follicle counts on the scalp.
Well, tell me a little bit about the procedures that take a day, a week, a year?
So they're both kind of different procedures. The PRP that Dr. Hill's talking about takes about 30 minutes, and that's just harvesting blood and then re-injecting the plasma back into the scalp where all the growth factors are from the plasma. An actual hair transplantation takes, majority of the day to do, but within a week you're well healed and you're already on your way.
Now, the slides up there that show some before and
Yes.
after, is that a typical result that you get?
Yeah, I think it's a very typical result. I think that that's what you can expect, and it's usually that around a year you'll see a very good growth of the transplanted follicles into whatever area you're placing them.
So is it one treatment, or do you have to do that continuously?
No, that's one treatment. So in one treatment, you can harvest somewhere around 2,000 follicles from a patient, and then transplant 2,000 follicles, which oftentimes becomes about 6,000 hairs to the area you're trying to transplant to treat that area of baldness.
And it's done in your office?
It's done in the office under local anesthesia. And the main difference between what we're offering and what is traditionally done is the traditional method is where they take a strip of your scalp and they have to surgically close that with sutures and staples, and that can leave a wide gap, like a scar that doesn't have any hair, that's highly visible. You can also have things like wound breakdown or infections, and what our treatment does is it takes individual follicles, so you don't have to surgically excise scalp, and then you transplant those individual follicles into the recipient site.
Well, that sounds great, and the look from the folks that I've seen that you've done really is good. It's normal hair.
It's been very rewarding for us.
Yeah, absolutely.
Lots of people are very happy.
I can tell you, I had it done myself, and it's been one of the better things I've done. It was very easy to recover from, and it's your hair, and it's changed, for me, a huge part of where I was previously, and like I said, there was very little downtime to recover from it. So now with one side being done, you can see now how this side of the brow is up, less hooding over here. This side still has brow ptosis laterally with some excess hooding there because it needs to come up to match. See your brow position now? You see the symmetry is like dead on. I think it looks great. And now your eyes are way more open.
That heaviness is gone.
Okay.
My name is Missy McCrae. I'm 58 years old, and I had eye surgery, my tops and bottom lids. I have wanted to have the eyelids, the droopy eyelids, repaired for many years. I really didn't even know who or how to start. So I made a consultation with Dr. Hill at Plastic Surgeons of Lexington, and I was very nervous about coming to the consultation. He put me at complete ease. I said, if I can only do one thing to improve my overall look, what do you suggest by looking at me? He said, you need to do your eyes. It will make the biggest change in your life, and you will love it. I began exercising and walking. I had gained an excessive amount of weight. I didn't care for myself, and I wanted to do what I could to improve my health through what Dr. Hill had done for me. I get a lot of compliments. As I said, I'm an older lady, and I feel like I'm 40. And the accomplishments are just, I can't explain it. It's just been fantastic. I was so excited from day one, and today is about a year and a half later, and I'm just as excited. I'm not looking back at all. I'm going forward. It has helped my social skills, my ability to look at others. I was always one to compliment women, and I just think a woman, when she takes care of her body, she is trying to look her best, and it will make you feel your very best ever. After I had my surgery, my husband was so impressed with what the results were that he scheduled a consultation with Dr. Hill and had surgery as well. When I said that I wanted more done, Dr. Hill explained to me that a lot of our patients want more and more and more. He said, we do it naturally. We want you to look natural, feel better about yourself, see the improvement, and still be 58 years old. And I do, but I feel 40.
I just wanted to stay home in my own little world, in my own little cubby hole, that I didn't have to see people, or people didn't have to see me. I needed to change it. My name is Ariane Lyons, and I'm from Manhattan Beach, California. I'm a California girl, born and raised. My skin before the Obagi Cleansiderm system was erratic. I used to have acne on the sides of my cheeks when I was in my early 20s, and I went into my dermatologist's office crying. My fiance called and he tells me, oh, I'm beautiful, I love you any way you look, even though people tell you that, you just don't feel it inside. Skin is important for me because it's the first thing someone sees. It's your profile photo on Facebook, it's your LinkedIn photo with your clients. I work in commercial real estate. All of us have to look really good. It's not just the voice on the other end of the telephone. It's when I'm knocking on doors and meeting people for the first time. If I look like I have acne, I'm gonna look a lot younger than what I am when I'm almost 30, and I am a young professional. Colin and I met where I was starting to get my bad skin. He's always so supportive, but when you have acne, it ruins your day. The real issue was when I started getting the hormonal acne around here, and it's just so painful. I would go into the bathroom at work and start to attack it. I also was using any kind of mask treatment. I put on things that made my skin drier, greasy, shiny. I did everything. The Obagi Cleansiderm system is amazing. When I wash my face, I use the Daily Care Cream Cleanser. It's a really gentle face wash, and now I'm putting on the therapeutic lotion, the power behind the system, my POW. And I can feel it working right away. And then finally, I use the therapeutic moisturizer, which helps with dryness. It's just so easy. I noticed the results in the first 2 weeks, and even 2 months in, my skin was gorgeous. I don't have to wear makeup like I used to. I don't have the types of zits that I used to have. I don't have zits at all. I do feel my personal best. Colin and I like to enjoy life together. We're getting married next October. I feel that I'm gonna be a beautiful bride. I'm gonna be able to put my best face forward for my wedding to start my life. When people ask me about the Obagi Cleansiderm system and how it makes me feel, it's my skin for life. It's who I am.
When it comes to skincare products, you shouldn't have to compromise. And now there's a line that offers the perfect balance. Hi, I'm Dr. Susan Obagi, board-certified dermatologist and cosmetic surgeon, and I'm excited to introduce you to a new skincare line that I helped formulate for Obagi. This advanced line offers complementary products that cleanse, protect, and renew the skin to help you achieve healthier-looking skin. This unique line of scientifically formulated products cleanses the skin of dirt and other impurities while defending against UV rays and rejuvenating the skin. When helping to develop the Susan Obagi MD line, my goal was to create products that offer the perfect balance of powerful ingredients and purposeful exclusions. The combination of clinically proven ingredients and antioxidants reveals healthier-looking, more radiant skin. Clinically studied, dermatologist-tested ingredients and antioxidants provide an effective regimen with a gentle touch. In keeping with our commitment to safety and environmental responsibility, what we left out of these products is just as important as what we put in. Every product in the line is dermatologist tested, hypoallergenic, non-sensitizing, and free of parabens, synthetic fragrances, and dyes. The result is a skincare line that offers a perfect balance for every patient. The unique formulas help to address the appearance of photoaging, such as fine lines and wrinkles, rough skin texture, and lackluster or delicate skin. Plus, the line is suitable for all ages and skin types, including sensitive or post-procedure skin. Just as no two patients are alike, neither is their skin. That's why the philosophy around this skincare line enables patients to incorporate products that are individualized to fit their skincare needs. The 3 steps are cleanse, protect, and renew. Talk to your doctor about incorporating other products from the Obagi portfolio into your regimen using this philosophy. First, it's vital to cleanse the skin of dirt and other impurities to create a clean base on which to apply products. Next, protect against UV rays to proactively minimize the visible signs of aging. And finally, renew and rejuvenate the complexion and skin texture with clinically proven ingredients. Talk to your doctor about the skincare line that allows for a range of options that can be used together or integrated with an Obagi system or product. The result is a completely customized skincare regimen for every skin type.
There's so many parts of getting a little older, now that I'm 35, that I really enjoy. I have a wonderful family life, I have a gorgeous son, supportive husband, a career that I love. But one thing that is on my mind a little more now are the actual results of aging. I'm doing everything that I can, but there's just those things that are just still starting to pop up. I have, this small line that has sort of always been there. I'm a really expressive person. I make a lot of facial expressions. I find that I'm taking more time in the morning, feeling self-conscious leaving the house without makeup on. I have tried another neurotoxin in the past. My husband, I'll make comments
comments, and he says, "Oh, you're crazy, you know, you look great."
I like walking arm in arm down the street with her and having the heads turn and everything else. I think subtlety is key. I think that she wants to look her best without maybe people even knowing that she's doing something like this.
I don't want to look overdone. I don't want to look frozen. I want to look like myself. I'm very confident that when I leave my house and walk into Dr. Kaufman's office that I'll be in great hands.
Dysport is approved for the treatment of moderate to severe frown lines right between the brows. And what Dysport does is it causes muscle relaxation in the frown lines between the brows. We can inject Dysport and target those muscles specifically, so it won't affect your expression in the rest of the face.
How quickly do the results kick in? And once they do, how long will they typically last?
With Dysport injection, you could see results as fast as 2 to 3 days, and the results may last up to 4 months.
It seems like this would be a sensitive part of the face. Will it hurt?
It's 5 tiny injection points along your brow. You could have 5 little red dots, and that might last for about 15 to 20 minutes.
Is there anything in the days after the treatment that I should look for or expect?
Side effects are usually minor, but can include maybe a little bruise at the site of the injection, or a little tenderness, or even a headache.
So once the Dysport is injected, what is it actually doing?
Dysport acts like a neuromodulator, which helps relax specific muscles. And the ones we're looking at are the muscles between the brows. It helps improve those frown lines.
The procedure was so quick and easy, virtually painless, and now I'm just excited to see the results. The minimal downtime is so important. I'm a working mom. I don't have much time to spend on myself and to spend on things outside of work and my son and my responsibilities at home too. I was only in the office for maybe about 20 minutes and was able to return right to work.
It was something that was so subtle to me that if I wasn't told about it, I wouldn't even have known that she had a procedure done.
The lines between my brows are something that have bothered me for years now, and it's nice to not have that to worry about. Dysport was able to target just my problem area.
I think when you look good, you feel good, and that helps you play good, but just having that extra bit of confidence goes a long way for a lot of people.
Eventually, I might have more concerns down the road, but right now that really was my main concern, and it's nice to know that there are targeted treatments that can help with that.
Hi, plastic surgeons of Lexington patients. I'm Katie Herndon with Reach Fitness. Here are some general fitness recommendations for 2 weeks post tummy tuck. You want to get your body moving and stay active with some light walking, some light cycling, looking for about 15 to 20 minutes of activity as tolerated. You want to avoid heavy pushing or pulling, not lifting things over 10 pounds. So be very careful with lifting children, lifting your groceries, and we want to hold off on things like yard work until a little bit later post-surgery. And as always, reach out to the surgeons if you have any questions as far as what you can or cannot do following your surgery.
We're introducing our new Evo micro pen. I love this pen, FDA cleared, the newest technology. Microneedling's been around for a while, but it does a great job for your skin. It's clarity, tone, texture, pigment. Lots of times people that have melasma don't know how to fix that. Microneedling's the way to go. And above all, acne scarring is a great match for microneedling. It usually takes 3 to 6 sessions, but you will love your skin.
My name is Katrina Aldrin-Miley. I'm 47 years old and I had a breast reduction. For the first thing, for my health, they were very large, they were very heavy. You know, I felt like it was something that I needed to do for myself. I most definitely feel a difference. I actually lost 7 pounds once my breasts were reduced. I feel a lot better, I feel a lot lighter. I don't have any of that same pressure that I had on my neck or my back. Now, the size I was a 34F, which translates to a triple D, and in some instances an H or an I. The size I am now, I'm not really sure because I'm still a little swollen, but I'm probably looking at probably a D or double D, which is in no way near the size that I was previously. I definitely could tell a difference. I definitely knew they were smaller, and I also knew that I also still felt like a weight was lifted from my neck area here. So I definitely knew that that there was a great difference in my breast size. Everybody at Plastic Surgeons of Lexington was very friendly. They were informative. They didn't mind to answer any of the questions that I may have had. Everything pretty much went smoothly. I'm just glad I came to that practice, and I'm glad that I had the procedure done. My surgeon was actually Dr. Michael Lynch, and I thought he was awesome. He was very friendly. Once again, any questions that I had, he was open enough to make sure that I felt comfortable enough to go ahead and have that procedure with no doubts in my mind. Plastic surgery pretty much to me is like an art form. Now, some people may do it for various reasons. You may do it because you have insecurities. A lot of humans have insecurities that we want to fix about ourselves, or I like to call it complimenting our beauty. But there are a lot of plastic surgery procedures that help people come back from maybe some type of deformity, maybe some type of disease that's taken their body away from its natural state, and they repair that. For me, it wasn't vain. It was just something that I had lived with those for years. And I was pretty comfortable with it, but I have to admit I did have some insecurities. And when it started causing me problems, I did it for my health, and I'm glad I did it once again, and I'm extremely happy I did it.
Welcome back. This segment is our cosmetic weight loss section, and here to help me talk about that is the Plastic Surgeons of Lexington, Dr. Lynch, Dr. Hill, and Dr. Moore. Welcome, guys.
Thank you.
All right. Now, I use the term cosmetic weight loss. Dr. Hill, that's really not, I mean, it's not, it's more body contouring, or tell me.
Correct. A lot of people come to our office thinking that we do weight loss surgery. That's not really what we are about. We typically contour the body after a weight loss surgery because people have extra skin, and to get rid of that skin, you have to, design patterns to get rid of it in a safe way, and that's really what we're trying to do. And that can be in the face, that can be in the arms, breast, tummy region, extremities.
But Dr. Lynch, the term everybody recognizes is tummy tuck. Who's a candidate for that? Weight loss and other things too, correct?
Correct, yeah. So I think when you're looking at the optimal surgical candidate for a tummy tuck, obviously you want to take into account their BMI. So you want to be, in the lower 30s, in that range there. You don't want to be too high there. You want to obviously be weight stable after your weight loss. So that's important because, like Dr. Quintero touched on weight loss surgery, you want to make sure you've lost the weight that you're going to lose and stay stable for a good 3 months or so, and then those people become very good candidates for all the surgery that we do. And obviously one of the big ones is the tummy tuck to address the weight loss skin in the abdominal region.
Okay. Now, other than weight loss, Dr. Moore, what kind of are there other reasons to do a tummy tuck?
If you're unhappy with your just general contour, and you just have that extra skin, maybe you didn't lose a ton of weight, but maybe you've more popular the mommy makeover, where you've had a child and you've lost the weight, but that extra stretch or that extra skin is still there. Those are great candidates as well, and that's very popular to do.
Well, now, Dr. Hill, is this something you have to be in the hospital for? Is it outpatient? What kind of risk are there involved with that?
It's a good question. So obviously any surgery you do, there's a little bit of risk with it, but multiple studies, thousands of studies have actually shown that outpatient tummy tuck surgery, for instance, is just as safe as doing it in the inpatient. We try to, make combinations of procedures together if someone has a lot of areas of concern, so you can combine, body work with an arm lift or a body work with a breast procedure. So we try to minimize the total number of surgeries that someone has by working together.
Okay. Now, Dr. Lynch, he mentioned arm lift.
Mm-hmm.
Arm, thigh, bottom, I mean, tell me about that.
You can do all that. So someone who loses a lot of weight, obviously essentially deflates. And so there's excess skin in multiple different areas, whether that's the arms, the thighs, the belly. With an arm lift, we're just contouring by removing excess skin. The same goes for thighs. If you have a lot of weight loss, you can remove excess thighs. We try to hide the scars in very acceptable areas, but it's mainly for a lot of people to wear clothing better and fit, and be more comfortable in their clothing when they're active and things like that.
Okay. Now, weight loss, you can see it in a lot of people's faces, Dr. Moore. I'm assuming you do facelifts. You do it for cosmetic, and do you do that for weight loss also?
Yes, but it's more considered cosmetic. But yes, you can do, it's more of a face and neck lift, because as you lose weight, you'll notice that it'll also happen in your face and neck. And so people like to address both of those at the same time, and that's very, very popular to do as well.
So what can somebody expect? They're not going to have assuming they're not going to have a six-pack. They're not going to look, like they were when they were 20-something years old. But what do they expect from the surgery results cosmetically?
Well, number one, a lot of times you're going to have a lot of scars, but typically those scars heal well, and over time they become, better. Six-pack can happen, but it takes a little bit more effort, like liposuctioning and things like that, as opposed to just cutting out extra skin.
Okay. Now, Dr. Lynch, he just mentioned liposuction. That's different.
It is different. I think that's an area that we use a procedure to contour certain areas to make it in a conjunction with removal of a lot of skin. It can also help contour an area, or that's your hips. You can use it in your arms, etc. But a lot of this for post-weight loss patients are going to be removal of excess skin. That's really where you get your best bang for your buck, is to remove all the skin that is now there after losing a considerable amount of weight.
So who might be a candidate for liposuction? Is it just mainly cosmetic instead of weight loss?
Yeah, I would put liposuction much more on the cosmetic side. For someone who's looking just to contour a little bit of an area to get it just looking a little better, that's going to be where liposuction comes in. It's not a weight loss procedure. It's a procedure to really help just kind of let someone, again, fit better in their clothing, etc. Whereas most of the operations we talked about here are after significant weight loss that you have to remove excess skin.
Well, that's great information. That's great information. So if you've lost a lot of weight and want to look better, these guys can help you.
Thanks. Thank you. This game. Dude. Is that who I think it is? Deion Sanders. Prime time. No one's gonna believe we saw him here. Let's grab a picture with him. Dude, like he's gonna want to take a picture with us. Well, if he doesn't know we're taking it. Do I really look like this? I mean, do I really look this tired? At least Deion looks good.
Right. Relax, man. I get it. I had the same concerns. But men out there should know that they're not alone. I decided that I'm going to do something about my noticeable frown lines and my crow's feet. So I talked to my doctor, and he recommended Botox Cosmetic.
Botox Cosmetic?
Uh-huh.
Isn't that for women?
Nope. I did it. The treatment only takes about 10 minutes in the doctor's office. Get in, get out, and get on with your day.
I'm gonna check it out. Thanks, Prime. Think we can get that picture now?
Oh yeah, the dude's ass.
Now, I said breast reconstruction, and it starts a lot of times with breast cancer.
Correct.
Tell me about the reconstruction following that.
Oftentimes, patients come to us not knowing a whole lot about what the reconstructive process is. The process for breast reconstruction starts off with the tissue expander, where we grow a breast pocket, and then we convert that at a later date to a permanent implant.
Does that start right at the time of surgery, or do you stage the process?
Typically, it starts at the time of surgery, unless the patient has a reason to delay the reconstruction.
Now, Dr. Lynch, is it everybody a candidate for it, or is there certain people that you want to do it?
I think most people are candidates for reconstruction. They're always given an option. Some are obviously better surgical candidates, and I think a lot of that goes into overall health. are you really a candidate for extended anesthesia time? But most people are candidates for breast reconstruction, and we see all kinds of different people to kind of figure out who's a better candidate. But most people certainly, can get a good result with the proper preoperative management.
Okay. Is it all the same type of implant procedure, or is it different?
There are numerous ways to reconstruct a breast. You can use your own tissue from your tummy, for instance, tissue from your back. 90%, 95% of the reconstruction that we do is utilizing implants as the final outcome.
Now, are there different? Tell me about the different implants.
So there's different types of implants. There's obviously silicone implants versus saline implants. I think now the reason Dr. Hill and I use so much implant-based reconstruction is the implants are so much safer than they used to be. The old stories of silicone implants leaking are kind of gone now. These new generation of implants that have been coined the gummy bear implants, you can essentially chop them in half and they're not going to leak. So I think that's changed the safety profile, and that's why it's very rare, at least in our hands, to ever utilize saline implants anymore. So pretty much silicone implants are our main form of breast reconstruction, and as well as cosmetic breast surgery.
And the risk of that's from the implant itself is very low.
It's very low now, yes. It's much, much less lower than it ever used to be.
Now, tell me about the recovery time. Is it outpatient, inpatient? How long does it take?
The first step, which again usually takes place at the time of a mastectomy, is the hardest step, and it's an overnight hospital stay, about a 1 to 2 week recovery. Most people feel better once drains come out, and that usually takes about 10 to 14 days. And then, it's a multi-step process to get to the final outcome, and the latter stages are much easier, and they're outpatient.
Well, we talked a little bit about breast cancer, but there's other reasons. There's other, I guess, medical reasons, other cosmetic reasons to do breast surgeries.
Yeah, I think that our practice is pretty also well-versed in cosmetic surgery of the breast, so breast augmentation, breast lifts. And so you can utilize implants for both of those to achieve your goals, and we do a lot of that as well in our practice as well.
Some people present to our office and they want their breast to look more shapely, and people are sometimes surprised that in order to make their breast more shapely, not only do we need to do a breast lift, but we also need to place a lower profile implant to give it a better shape, because as we age, we lose a lot of volume in the superior pole of the breast, and there's no way to physically push breast tissue up there and keep it there. It won't stay. So you have to use an implant to give it a better shape.
So for medical reasons, cosmetic reasons, you do the reconstructions, and then you're left with, okay, do I get a mammogram next year, and how do the implants affect a mammogram, Dr. Lynch?
So for someone who's had breast cancer, they don't really need mammograms anymore because they're no longer breast tissue, and they would follow up with an MRI if there's a question. Whereas someone for a cosmetic reason can still get mammograms. There's no change in that at all. Mammographers are very well versed now because cosmetic implants are so popular and so prevalent. It's standard of care to do a mammogram with a breast implant. Does not cause any difference at all. Doesn't cause any change in your cancer screening profile either.
I am a wife, I'm a mother, I'm a daughter, I'm an aunt, I'm a fitness instructor, I'm a small business owner, I'm a dog owner. My name is Corinne Brown. I am born and raised in Savannah, Georgia. I like who I am. I feel comfortable in my own skin. I am a Georgia peach. I first heard about the Obagi New Derm system from my mother. She brought it home and suggested that I use it, and I've been using it ever since. Her skin is gorgeous. She was always very adamant about the sun. I was the child in the pool with zinc oxide all over my face, the hat. I've just always had very fair skin. When I moved to Savannah, it was a pretty hectic time in our lives. I just kind of lost I call it my rosy glow. I just didn't feel good about my skin, and I didn't feel confident about the way I looked. The dark spots started to come back, and just fine lines. I didn't really like the texture of my skin, and Obagi New Derm System brought my skin back. I get up in the morning and I start with the cleanser, which is wonderful. It's very smooth. It smells divine. I love the fact that Obagi New Derm System is numbered. It makes it just so much easier to use. And on to my next step, which is the toner. Number 3, the clear. If you have sunspots, this is what fades them. And then I move on to number 4, and that is your exfoliant.
And to me, it really doesn't even feel like a exfoliant. It goes on super smooth. I hydrate, and that's your moisturizer. And the last thing I use is their sun shield. It absorbs quickly, doesn't leave a white film on your face, and then I get the excess off and I put a little bit on my hands. And that's my morning routine. I notice a difference pretty much within a couple of weeks. It keeps my skin looking the best that it possibly can look. The Obagi New Derm system makes me feel very confident, and I think a little sexy and sassy. The advice that I would give to women my age is, I think skincare is very important. Exercise, I think, is imperative. Anything just to get the blood pumping. Get ready, sucker. Something about hitting something that is just so cathartic. Boom. People always tell me I look young for my age.
When I first met Corinne, I thought she was in her mid to late 30s. Her skin is gorgeous.
I am 49 years young. My skin was glowing when I met my husband because I was using Obagi. We have this beautiful child named Harris Lawton Brown. He's 7 years old. He is full of beans. You went through the bar? He's just a bright spot in my life.
I caught it. I think her skin looks really good.
Your skin and your face is your gift to the world, and so I think it's very important to put your best face forward. Try to be the best that you can be. I think the Obagi New Derm system has kept age at bay for me. And I think it's going to keep it that way through my 50s and 60s, hopefully 70s and 80s.
When we worry about lines and wrinkles forming as we age, we tend to focus on the upper part of the face. But did you know that your lips and mouth area can show visible signs of aging as well? With age, fat and collagen that were once evenly distributed can deteriorate, resulting in thinner skin and noticeable lines and wrinkles. Lip shape, fullness, and definition are based on a variety of factors, including genetics. Over time, lips become thinner and can lose definition. The Cupid's bow of the upper lip begins to flatten. Vertical lines appear and become deeper with age. Even bone loss can occur, resulting in decreased lip volume and lengthening around the mouth. For more information, talk to your doctor to find out how you may be able to address these signs of aging.
Welcome back. My next guests are plastic surgeons of Lexington, Dr. Joseph Hill, Dr. Michael Lynch, and Dr. Evan Moore. Thanks, guys, for coming in.
Yes, thank you.
Now, you do a lot of stuff and you make a lot of people pretty, but we're going to start at the top of the head and do the face because you've done a lot of facial work and it's not just one thing. Where do you start, Dr. Hill?
Well, if someone's coming in for facial rejuvenation, I typically like to start at, the forehead, brow area, work our way down, eyes, and then on into the face. It's typically how I kind of look at somebody.
Now, Dr. Lynch, you mentioned eyes. Do you do, it's called a blepharoplasty?
Correct, yeah, that would be the surgical term that we describe, and that involves different things whether you're doing the upper eyelids or the lower eyelids, and then with regards to that surgery, usually you're addressing some amount of skin excess in the eyelids, and then also some amount of additional periorbital fat, and to rejuvenate the eyelids with a blepharoplasty.
Now, Dr. Moore mentioned lower and upper lids, but sometimes there's a cosmetic reason, sometimes there's a medical reason also?
Yes, it's more for the upper eyelids, and that excess skin can cause, they can be heavy because your eyelid muscles aren't as strong, and so they can block some vision. And if you go see an ophthalmologist and do visual fields, you can get evaluated for potential getting an upper blepharoplasty covered by insurance. Okay. But lower blephs are typically not covered by insurance.
Okay. Now, Dr. Hill, you mentioned forehead.
Mm-hmm.
Do you do surgery on the forehead, or there are non-medical or non-surgical treatments cosmetically?
Yeah, there are. Botox in particular, or Dysport, there's a couple other neuromodulators out there. Depending on how you inject it into the forehead can raise the eyebrow, and an eyebrow that's lowered or ptotic, so that's what we say,
can block your vision. And so, putting a neuromodulator in the forehead can elevate the brow and potentially help you see better. Typically, though, that's for cosmetic purposes, not necessarily, and insurance wouldn't cover that.
Well, I got to give you a shout out too, because you did operate on one of my family members who had a very large skin cancer, and you did a great job, and you can't even tell. So I'm assuming you do some of that too.
Yes, skin cancer work. Yes, we see quite a bit of skin lesions, skin cancer, things of that nature. Sometimes the dermatologists refer, sometimes patients self-refer.
Well, yeah, you did a great job.
Well, thank you.
You did a great job. Now let's work our way down.
Sure.
Nose.
Yes.
What do you do to the nose?
Depends on what the person wants is how we usually kind of go about it. I mean, I think there's different aspects to what's referred to as rhinoplasty, depending upon what that person's cosmetic goals are for their nose, whether that's a prominent hump in the nose or tip refinement to kind of get where a person wants, or kind of the main things you look at when you're evaluating a nose and trying to determine what surgical pathway to follow.
It's interesting you said what the patient wants, because I guess beauty truly is in the eye of the beholder, and you really want to do what they want.
So I think it's extremely important, and it's probably the most important, in my opinion, when you're evaluating someone's nose. I think the nose is kind of the centerpiece of how you address some people and talk to them, along with their eyes. And so if you change someone's nose more than they want, I think you can create a problem that is not desirable. So that's why, at least in my opinion, I know my partners are the same way, you look at and talk with the patient what they want to achieve with each surgery you do, and then you stick to that plan.
Great. Now, going on down, I guess chin, lips, Dr. Moore, you do that?
Yes. Lips, predominantly, you can do filler. Some people, particularly with massive weight loss, can have a lengthened lip, and we can do an upper lip lift, which is just a fancy term of cutting some excess skin to kind of elevate the lip. Chin, you can do chin implants as well, in terms of modifications that we do. And that just all, again, varies with, talking to the patient, what they want.
All right, Dr. Hill, let's just talk about facelift in general. Is that different from what all we just talked about here?
It is. It's, as we age, we gain extra skin. Typically how I describe it is when we're youthful, we're like an egg on its point, and then as we age, we're kind of an egg on its larger round base. And we gain weight in our kind of jowl area and our neck, and so part of the procedure is to remove excess skin, and part of the procedure is to revolumize the face. And we revolumize the face by working with the tissues under the skin, and also sometimes we'll add some fat graft to the face in key areas.
Well, that's great information. You guys do great work. Thank you for what you do, and we appreciate you coming in.
Thank you.
Thanks for having us.
Yeah.